Thank you so much for being here, whether you're here live or able to watch our video at any other time after the event. But welcome to our empowerment session on behalf of Shakthi. Shakthi is a nonprofit organization that creates a supportive environment for survivors of domestic violence and intimate partner abuse, with a focus on the South Asian community. By recognizing the unique cultural circumstances of our South Asian community and providing culturally sensitive resources, we forge empowerment and assist survivors and children and families to develop independent, healthy, violence-free lives. Shakthi was started in 2018, and we are based out of Central Florida, and we are growing rapidly every year. We offer education, empowerment, resources, and support aimed at preventing and breaking the cycle of domestic violence. So most of our calls for help fall into the categories of somebody needing safe housing, where they need to literally keep themselves and maybe a family member or others safe from an abuser, or needing some legal advice and help in regards to immigration or protection orders or other things like that. We also provide a lot of service to our local shelter events and things like that. And Shakthi has really been gaining momentum through the South Asian community as being known as being there for one of our members. So I am delighted today to introduce Dr. Beena Parikh. She is a dedicated Central Florida native with a diverse and impactful career. She earned her Ph.D. in clinical psychology from Nova Southeastern University and returned to Orlando to help children, adolescents, and families navigate mental health challenges. Dr. Parikh is deeply committed to giving back to our community, not only through financial contributions, but also by dedicating her time and expertise to several causes. Dr. Parikh serves on multiple advisory boards where she works on initiatives aimed at improving youth education, housing, and health programs, and providing essential healthcare services to the underserved and underinsured populations. Dr. Parikh and her husband, Dr. Amish Parikh, are passionate about the arts and community development. Balancing her professional, community, and family commitments, Dr. Parikh brings boundless energy and enthusiasm to all of her endeavors. Through the Parikh Giving Alliance, she and her husband continue to contribute to the betterment of the community. So we thank you so much, Dr. Parikh, for being here. We appreciate you investing in our community. So this is the month of May, and it's my understanding this is Mental Health Awareness Month. So this is about perfect timing for us to be having this conversation of breaking the stigmas of mental health in the South Asian community. So this month, we are reminded to sort of slow down a little bit, tune in, take care of what matters most from our emotional and mental well-being, and an invitation to just sort of pause and reflect and take care of ourselves first. So as we begin to talk about mental health, Dr. Parikh, if you could give us a little bit of an intro as to what we're talking about mental health for this call. What is it and what does that look like?
Sorry, technical glitch there. Thank you again, everyone, for having me. I'm honored to be here and really empowered, to have this conversation. Obviously, it's near and dear to my heart, being in the field, and I love talking about it. I think it's the more we talk about it, the more we break through those stigmas, the better. And we're only going to, create conversations that are easier to have. So I'm grateful for you guys offering this platform for me and for everyone else to be able to be here. Your question of, what is mental health and what are we actually looking at? I think most of us would be aware of what kinds of things we're talking about. There's there's the severe mental health psychosis related ones that are things like schizophrenia, bipolar depression, that are very obvious sort of issues and people are struggling, and it's easy to kind of tell that they're struggling. And then you have your standard, quote unquote, run-of-the-mill mental health issues that are more aligned with depression, anxiety, attention deficit, things like that, right? But those things, unfortunately, tend to be not viewed as really mental health, right? We have done ourselves a disservice in separating out physical health from our mental health, and which is an odd thing coming from a culture where we are so focused on things like yoga and meditation that is really about bringing those two things together. We don't do a very good job when it comes to the illness side of the mental health. We want to kind of pretend that doesn't happen. And when I say we, that's not a issue that's specific to the South Indian community. That's human nature. We don't like to want to admit that there are problems. And so those run-of-the-mill everyday kind of things become this issue of, you know, will and what kind of pull up your bootstraps and what kind of oomph do you have to get on with life, and it becomes a character flaw in some ways. But the reality is that we are dealing with real issues and real problems. So if I may just share just a couple of little things when it comes to general mental health, Florida actually ranks number 1 in the nation for having mental health issues. And which is kind of shocking, right? You have sunshine, beautiful water, and all of that, but you have a very transient community here and a lot of people coming and going. And it's we can talk about the economy of a tourist related industry, a service industry that has its own ups and downs that creates instability. And with instability comes mental health illness. So Florida is actually one of the highest in prevalence of mental health. And the reports show is upwards of about 23 to 24% of Floridians are experiencing some sort of depression and anxiety that isn't even being looked at. No one's talking about it. Like, they're just walking around trying to make it every day, which is kind of crazy when you think about it. If you were to kind of break that down and look at the South Asian population, now I'm going to give you these stats, and knowing that our ability to gather research on the South Asian population isn't that great, still, the research shows that 1 in 5 South Asians actually are experiencing some sort of mood and anxiety disorder, or will have experienced some sort of mood and anxiety disorder throughout our lifetime. So if you look at our board right here, there's what, 12, 13, 14 of us, right? So at least 3 of us have or will experience some sort of mood and depression, which I think if we're all being honest with each other, that's true, right? There isn't a single point in my life where I can't say that I struggled, or that I didn't struggle. Whether it was turning 50, whether it was, having both kids leave the home, whether it was deciding to close my practice, those kinds of adjustment situations also create mood and anxiety disorder that we struggle with, and sometimes they linger. And we need to kind of be able to talk about that. Another study looks at the prevalence of substance abuse, right? And substance abuse, anxiety. And if you look at all of that, the lifetime rates are actually 1 in 4. When you put all of that in there, alcoholism, drug abuse, and then if you add the mood disorder and anxiety disorder to that. So we're a community that really needs to be able to have these conversations in a much more open fashion. If I were to dig down a little bit more and come down to sort of some of the things that you've just talked about, Jamie, if we look at women, particularly, women have higher levels of reported distress than any other group in the studies, and amongst this population, our South Indian population, suicide is actually the fifth leading cause of death among South Asians, right? And that's comparing it to, non-Hispanic, white, general population. And then when you look at, again, that subsect of women, South Indian women, they have actually some of the highest rates of suicide in all of the groups. So we're definitely dealing with issues and problems in our community. We clearly don't know how to have conversations, whether we're the ones having the problem or maybe we see someone having the problem and we just don't know how to do that. So this is super helpful. This is super important that we're doing this. And being able to kind of have that conversation about physical health, mental health, and then the problems that the subsect of problems that it brings on, alcohol abuse, domestic violence, drug abuse, those kinds of things. I think we need to be able to have more and more of these conversations.
Yeah, I did not expect the stats to be that severe, so that is helpful to hear. I don't think that us having this conversation is us taking that next step and being brave. So one thing the founder of Shakthi Madhu said is everybody knows somebody who is going through some sort of domestic violence issue. We just don't want to talk about it. And I think that even expands greater when we're talking about mental health, because the two seem to be so interrelated. So you can have a highly functioning person, and I say highly functioning, meaning they're taking care of their family responsibilities, taking care of their whatever responsibilities that they have, but they could still be suffering with some sort of mental health challenge or mental health issue. So one thing that I found, there were a lot of stigmas about mental health, especially in the South Asian culture. So I'm wondering if we could dig through some of these just to take a look at them and see how they relate. So
Absolutely. I think, when it comes to stigma and taboo, it is
yes.
very much still a prevalent thought process. We don't talk about these things. We fear dishonoring our family. We fear loyalty, being disloyal to our family when we seek help outside of that family. Right? We are in the South Asian community, we are a collectivist mindset versus the individual mindset that is more prevalent in the Western societies, where the individual needs and the individual goals and thoughts have a place and have a space to live. But in our South Asian communities, the greater good and the loyalty to the family far supersedes that, and we have more of a I hate to use this word democratic, but a little bit more of a democratic approach. We kind of take a vote, we listen on what everything's being said and done, and everyone kind of takes a vote and on whether it's a problem or not, it's not a problem, and then we move on. And more often than not, we say, yeah, no, I don't think it's a problem, because the whole family, is thinking about all of these other taboos and other stigmas. What will the community say if my, child is out there getting therapy? What does that say about me as a mother? What will the community say if I go out there and try and get counseling? What will that say about my husband as a husband, and my marriage, right? So we start to worry about all of those things. And again, I don't think that's as um, not prevalent in other communities, but given how much of a focus there is on multi-generational and blended families in our South Asian communities versus that nuclear family concept in Western societies, it becomes a little harder to kind of just go out there and say, no, I need help and I'm going to go get it, because there's 5, 10, 15 other people that are in your business trying to figure out, well, why do you need to go talk to somebody else? Can't you just figure it out here?
That multi-generational, I think, is a key aspect because, like, first generation immigrants, they were here to survive and thrive. And I mean, whether we literally said they didn't have things like cell phones like we do today, right? Always have that communication device in our back pocket, but things were different, and things that were luxuries for them are different from us today. And getting that generation to sort of understand, right? We really do appreciate the sacrifices that they made, but also having that conversation today about how we're feeling can also be okay. So
Mhm.
I think this multi-generational or this generational gap is a big thing due to perceived stigmas or cultural stigmas that have existed for a while out there. And you alluded to some of these with like some of the family shame, right? And keep our business private, like, don't we don't want to talk about this. We don't want anyone to know this. I also feel like even mental health, just the words have a negative stigma, even though we all, want to have a balanced mental health and well-being, and we want to be able to handle life's ups and downs without, too much struggle or difficulty. But there's this sort of stigma about mental health that you're crazy, or there's an illness, or there's, the medication side of things. And I do think the generational gap really reinforced that for us. Um, what do you think, like,
Absolutely. Sorry, I was going to say
no, go
absolutely. I
on.
think when I guess technically I was born in India. I came when I was about 8, 9 years old. So I was born in India, so technically not first generation, but as close to first generation as it would come without having been born here. But I think the difference was that, yes, they are here. My parents were here surviving and trying to thrive as much as they could. Um, and at the same time, there was a couple of thoughts that I had when you were talking. At the same time, when you mentioned cell phones, right? Like their parents had to watch their children leave. Most of
Mm,
us left in the 60s and 70s, and there was no cell phones. And
right.
in many parts of India where I was from, we didn't even have telephones. I remember my first telephone experience sometime in the early 80s at my uncle's house, my grandmother's house, actually got a telephone. And I remember our number was just a 2-digit number. Now it's a, standard 8-digit, 9-digit, whatever the number is. But it was a 2-digit number. That's how early on in the process we were getting that. Um, but what I was trying to get at is that their parents had to let their children, and for some, their grandchildren, go all the
Mhm.
way around the world practically and have no idea what kinds of things they were dealing with. So the parents just had to sort of trust their way that they had to raise their children, the foundation that they established in them, the cultural values that they put onto them. And those parents really had no other option but to live up to those expectations
Mm.
of what their parents had for them, to abide by the teachings that they were given, to abide by the values that their families live by. Um, and the problem was that there was nobody that was helping them, guiding them, telling them that it's okay. You're trying to balance two
Oh,
cultures.
so
You're trying to raise children in a different culture. And at the same time, they're living a completely different lifestyle. So it brought me to the idea of what's the difference between culture and lifestyle, right? Culture
yes.
is the values, the norms, the traditions, the things that were passed down ancestrally, regionally. That's our culture. Lifestyle is more the framework within which we make our own individual life choices using our culture, but we actually have choices that we make. That's the lifestyle, right? And so what happens for a lot of these immigrant parents and first generation is they're stuck because they left India
Mhm.
with a certain understanding of what that culture and lifestyle was going to look like. Now they're living in a completely different lifestyle. While the whole time, the folks that are actually living in India have moved on, right? They've evolved, they're modernized, they're moving on. Their culture is their culture. They're not so desperately trying to hang on to something that they left 25, 30, 40 years ago, because they're living it. So they don't have to worry about losing their identity or their cultural identity because they're in it. Whereas when you're talking about immigrants, that is one of their biggest fears, is losing that cultural identity, because they don't have that elder person beyond them that says, you're good, you're doing a good job. You've managed to do both of those things. And that's actually a pretty neat thing to be able to balance those things out. But for a lot of those immigrant parents, they don't have that, right? So they're left with going, oh my God, I've done a disservice to my family. I'm not uh, doing the things that my parents would have done when they're dealing with issues of mental health, rebellion, teenage issues, otherwise Westernized, issues. So culture and lifestyle often create the sense of um, wanting to keep up with culture, can often create the sense of failure within the mindset of folks when they're trying to just make ends meet.
Yeah, and the pressure already for them to thrive here is enough, let alone what you're saying. So I could see how there is that inclination, right, to uphold those values and things like that. But there are like misconceptions people have about therapy. So mental health, and I appreciate you at the beginning, giving us the two major categories of the severe and then really the standard mental health issues and how they're both prevalent. But there are like misconceptions in the South Asian culture about therapy. And some of those misconceptions feel like they're like a barrier, very difficult to get past, and we are shaming our family or shaming our culture or maybe even our religion, or like how do sort of all these work together. So there are some individuals that will say, like, why do you need therapy? You can talk to friends, that's just as good, right? Like, oh, that should be okay. Or you're not weak, you're not broken, you should be able to handle this, right? That should be fine. Like, there's a negative stigma attached with seeking help for those issues when there is a lot of respect in the community for physical ailments. And then I go to the doctor to address those. So there seems to be this big like diversion between I can address my physical ailments for the doctor, but to address my mental health kind of issues with a therapist are not as always like, oh, thumbs up, go for it. Let us know how it's going, right?
Sorry, did I freeze or did you freeze, Jamie?
Jamie froze.
Jamie froze.
I
Okay.
froze. I
Okay.
froze.
Yeah, no,
Yeah,
you're
just
good now. You're good.
I don't know how long I froze for, so I don't want to repeat, but I was talking about the misconceptions about therapy
Correct.
and that, yeah.
Yeah, so absolutely right, right? Therapy is considered a violation of confidence, of that family confidentiality that you're supposed to maintain, because what don't we do? We don't air our dirty laundry. That's meant to be kept inside. We're not supposed to look, as you said, crazy. And yes, way oversimplified when I said, the more severe illnesses and then kind of standard run of the mill. I don't mean to simplify them and minimize the devastation that can still be depression, anxiety, all of those things. It can still be quite devastating. But at the end of the day, right, the shame, as you mentioned, is what makes it so difficult to talk about what is going on. And then there's this whole notion of confidentiality, right? I use that word. Are we allowed to talk about what happens in these conversations? And I think we get this mixed up message about HIPAA violations and all of this stuff. And then suddenly we're like, okay, no, everything needs to be kept a secret because no one can share. And if we share, we're going to be doing something to, and I get it. I get as a psychologist, I'm not condoning, breaking confidentiality. I think there's an absolute need, but that should stay within the doctor and patient, so that doctor-patient confidentiality can be there. But we've managed to expand that into our families, and into our own mindset that says, no, we can't break that confidentiality agreement that we have with our family. And there's a problem with that, right? We need to be able to have these conversations so that we understand that this is okay. What actually happens in therapy? Well, you're going to go in and you're going to kind of talk about what you think you came there to talk about. And in starting that conversation and in starting to have that conversation, the professional is able to start seeing points and moments that are in misalignment to what you might be saying and what you might be feeling, right? And therein lies where we feel anxiety and depression. We're often saying something like, I feel fine, but then what we're actually feeling or expressing is anxiety, right? My stomach hurts. I have a headache. I'm jittery. I'm restless. That's our body's way of saying, this is what I'm actually feeling. But our brain and our mouth are saying something different. And so the professional is able to then kind of go in there and say, hey, I hear you saying this, but I also see you being restless, or hear you telling me that you struggle with headaches, have an upset stomach, you have GI issues, whatever those physical presentations are. Because more often than not, that's how, particularly in the South Indian community, we present is more often with physical ailments, because we're not so good at verbally expressing what might be going on with us. So we kind of tamp that down. The more we tap that down, the more that emotion's got to go somewhere, and it's going to come out somehow. It will find its way out. And how it does is, I'm not sleeping well, or I'll get up in the middle of the night at 2 or 3 or 4 in the morning and I can't go back to sleep. Or I have a hard time falling asleep because my head is spinning and I'm racing my thoughts and I'm thinking about everything that I did today and what I could have done better, and what I have yet to do tomorrow, and how I'm not prepared to deal with any of that, right? All of those kinds of thoughts. Now, what do you do with that? Well, I'm trained as a cognitive behavioral therapist, so I would sit down and say, let's challenge some of those cognitive thoughts. Let's look at, what are you thinking? What is causing you to think that way? What is the origin of those thoughts? And then kind of helping you figure out, how do I challenge that? How do I find information that is different in my environment that can help me support a new narrative that I want to kind of spin and put in my head? Right. So that's where the professional comes in and is able to do something that's different than just having a conversation with a friend. Absolutely. Having a conversation with a friend is absolutely vital, because our friends circle, our social network, our family network, they go on long after and in between the times that you're seeing the professional. So sometimes you're not going to see me when I was practicing. You wouldn't see me for 2 weeks, right? So I'd have an appointment with you every 2 weeks. Well, guess what? Life is still happening for you in those 2 weeks, and you need to be able to have an outlet, a safe space that allows you to express what you're thinking, what you're feeling, and not be judged, not be afraid that you're going to be punished or abused or, in some way otherwise dismissed for having those emotions or thoughts.
The things you talked about being stressed out about or being worried about seem very human to me and very global, regardless of where you're from or even what age you are. Like there's always something that has your focus and will keep you up at night and kind of right. So that feels like just a human trait, very common across the board. There is this stigma about medication and therapy, and I want to just touch on it for a minute because I think there are some assumptions being made that about medication and therapy, like if I start, I can never stop, or some of those things. So maybe you can just kind of give us a little bit idea of how the medication part fits in.
Absolutely. As much as I am a psychologist and did not go to medical school because I wanted to focus on the therapy side of treatment and have the conversations and the education and the behavioral changes to help with mental health, there is absolutely a place and a space and a time and a need for medication. The best way that I can explain it to folks is there is an entire manual called the DSM, right? The DSM is our manual for mental health diseases. They're not mental health issues. It's not called the Diagnostic and Statistical Manual for Mental Health Issues. It's called mental health diseases. We also have the disease coding for physical health, right? But we don't have a problem calling those diseases, but we have a problem recognizing mental health as a disease. So that's our own, right? Personally, I don't want to walk around saying I have the disease of depression, right? I don't want to say that. It feels weird. It feels awkward. But the reality is that that's what it is. And if I told you, Jamie, if I was a physician and I told you, hey, you're 45, I don't know how old you are, but you're 45 and there's some, early signs of diabetes, right? And we're going to have a conversation about what does that mean? Early signs, there's some interventions that you can do. Here's the likelihood that this will actually form into something more serious. Here's the likelihood that you'll have the chance to manage it, doing some lifestyle changes, right? So we're going to have that conversation as a physician with you, knowing that there's this disease that's sort of lingering in the background. It's not full blown yet, but we kind of see it, right? And we're going to start that conversation because we want to see if you can intervene as soon as possible. Well, the same concept works with mental health, is that if we can start to have that conversation early on, we can do some things to intervene. Whether it's talk therapy, whether it's exercising, whether it's yoga and meditation, whatever those things are that can actually mitigate some of that depression and anxiety, it's absolutely true. However, if you get to a point where your diabetes is now, 150 fasting blood sugar or a 300 after you've eaten something, well, that's not going to work because in the long run, that's going to kill you. Right. So now we need to do what? We need to get medicines on board because whatever lifestyle changes you've made and whatever healthy choices you're making in terms of your diet isn't working, and you have now full-blown diabetic disease, right? Would you still say no to me about taking medication?
No, I
Right?
would not.
And I can guarantee you, I only see a couple faces. I can guarantee you there's not a single person on here that would say, yeah, no, I'm not ever taking those medications because I want to be diabetic, right? Because we know that diabetes, in uncontrolled diabetes, is deadly and it's awful. It's an awful, 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 detrimental way of destroying your body, right? Well, guess what depression and anxiety do that's uncontrolled? The same thing. It's potentially deadly, as I've just talked about in terms of the suicide rates, right? It's invasive, and it's pervasive. So it can take over you and it can actually invade into the space of the people that are immediately around you, your nuclear family, your husband, your children, your parents, whoever is around you, your friends, right? So the fact that we won't have that conversation about the disease of depression and anxiety in the same way that we have about the disease of diabetes is where I want to champion these conversations and say, look, we need to be able to talk about this. And medications are amazing, amazing partners in what I'm trying to do for patients when they come to see me. For many of them, I can't make the impact that I need to without them on board. And the best way that I can explain that to you is if you and I are at a concert, Jamie, and loud concert, we're in a stadium, and you're talking to me and you're yelling at me. And I'm like, what are you saying? I can't hear you. It's not because you're not talking loud enough. It's not because I don't understand English. It's because there's just this noise. If I step outside and say, hey, let's step out into the hallway out and we'll go get a drink and whatever, and you say the same exact thing to me, guess what happens? I'm actually able to understand you, right? I go, oh, that's what you were trying to say. Medications, what I describe it as, is it turns down the noise. It turns down the noise so that what we're trying to do, whether it's in therapy, whether it's with your friends, whether it's with your family, the things that they're saying to you, the things that someone's trying to offer to you is now actually making sense because that noise gets turned down. It's not because you're not smart enough to understand. It's not because you're too sick to get better. It's we needed some help. We needed another partner, and that's where medications come in.
I love that example you gave because I can really see like minimizing, turning down the noise or the distractions or things like that. And using your example like of diabetes or pre-diabetic, you know, there are certain dietary recommendations that turn down the noise, right, on that glucose level going up or exercise, right, and other things. And we're so willing to support each other and be like, hey, you want to go for a walk, but want to go for a talk, right? It doesn't seem to be as like, oh, let's do that. Like, no, how are you really doing? Don't just give me that. I'm fine. I'm great. Da, 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 da. My kids are doing this. I'm doing that. No, how are you really doing? Like getting to that nitty gritty. And I really appreciate what you said. Like it will present itself and it will basically it's not going to go away just because like, oh, you can't see me, depression, I'm not here anymore, right? Like no, I'm not, I don't see you, you don't see me. I mean, it doesn't work that way, and it just seems to get like worse and worse, much like to your example of the diabetic presentation. The clinical symptoms will continue to escalate, right, the more we don't address it. So
Absolutely.
What do you think like are some, I don't know, warning signs maybe or something like if we feel like, or somebody we know, so I'm going to say I'm asking for a friend. What are some warning signs or things we can look out for somebody who may benefit from having that conversation?
Yeah, I think, you know, the obvious would be symptoms, right? So
Okay.
as I mentioned before, you've got sleep disturbance. I'm not sleeping well. I can't get to sleep. I'm waking up. I'm not eating. I'm losing weight. I'm gaining weight. I am, you know, feeling like I don't want to be here anymore. I'm overwhelmed. Listening for keywords, right? Keywords like, you know, I feel overwhelmed. I feel empty. I feel lost. I feel confused, right? You might not necessarily hear them say that exact phrase, but if we listen enough, if we put on our listening ears to what our friends are saying to us, we'll hear that message. And if we piece enough things together, we'll be like, hey, you know, it sounds like it's been really difficult since the kids have graduated and gone off to college, for you to find, you know, your purpose. And what does that feel like? And what are you doing, right? We need to be able to be better about it. So that kind of brings me on to what are some of the other things? Lifestyle, right? And I'm sorry, not lifestyle, life milestones. So at certain milestones in life, we need to be able to recognize that those are also points in time when we're struggling. And it's okay to say, hey, you're in the midst of developing your family, right? You're talking about 25 to 35-year-olds. What are they doing at that time? They're, highly motivated in their education. They're highly motivated in their career and highly motivated in developing their families. It is just full on growth mode. Well, any of us that have been there know it also is one of the hardest, suckiest, just put your head down, don't look up until you get to the end of the line kind of time too. And it's not until you look back on it and go, oh my God, how did I get through that? Right. And I think being able to have that conversation again, when we see whether it's our friends, the younger generation, like I'm starting to see that because I'm in the older generation now. So I'm starting to see that in that next generation of kids, my friends' kids that are struggling with finding that first job out of college, and that stress that they feel, because guess what? They're still trying to live up to their parents' expectations, the family demands, all that, all of those things, even though they're American born, second generation kids, that family value still passes on to them and they're struggling with that. So have that conversation when it comes to, certain milestones that we see our friends and our family members going through too. And don't be afraid to say, hey, this is going to be a rough time. You're going to be alone for the first time in 20 years. And what can we do to make sure that we're going in this together, that you're going in this as healthy as you can be? Because it's going to be different.
I appreciate you mentioning the milestones, because I remember when I was pregnant with my son, there was a lot of resources, a lot of information. Everybody was so excited, right, for that milestone of my life. Now that he's a teenager, I'm looking around. Where's the advice? Where's that book? Where are we going to have a teenage shower? The fact I've made it to this milestone and I'm going to make it and I will keep going, right? And then it even gets more intense as I'm caring for elderly or aging parents.
Correct.
And that is a stage that I feel like is so significant for me that nobody talks about. And that causes a lot of stress.
Correct. Yeah, we haven't even gotten to that side of mental health, right? Is the caretaker burnout. And we're seeing that very, very much so play out here in the United States, mostly because we've shifted from that multi-generational, multi-family unit that was India to a very nuclear family that is here. And now guess what? It's one or two people caring for elderly parents, whereas before we had aunts and uncles and cousins and everybody that was coming over to come see your kakya or masi or whatever, and there was a lot of other outlets, and now there isn't. And that caregiver burnout is really starting to ratchet up, and we see that in American culture, Western culture anyway, right? That caregiver burnout is definitely a big issue in it. So
yeah, caregiver burnout. Thank you for, I guess, seeing us and acknowledging us, because it is something that feels like just suck it up and figure it out. And there just aren't a lot of conversations happening about that. So I appreciate you just being able to put it out there.
And it's important. I'm sorry, I didn't mean to jump in, but I think it's important,
yes.
right? Like I have a cousin whose dad is going through dementia, and it's very progressive. And her sister lives out of state, and so they're trying to figure out how do they navigate this. And so she was very open and said to her sister, "Look, when you come, I don't want to see you. I don't want to, when you come in for the weekend, I love you, but I don't want to see you. I don't want to talk to you. I don't want to have dinner with you and mom and dad. I need 48 hours off," because she's the primary caretaker, right? And so when the sister can come in, she comes in once a month, twice a month. It's for 48 hours, and that's all. And that's a pretty powerful thing for her to stand up and in a moment of self-advocacy that says, I love you and I appreciate you wanting to come in and help me, but don't take offense, but I don't want to see you. I don't want to be obligated to have to sit with you and my parents and do dinner and have conversations, because that's what I do every other day of my life. And I want 48 hours. And I was pretty proud of her. And that's the kind of sort of self-advocacy that I would love for us to be able to be okay with saying. But in order to do that, we have to have that network and that support and a place that's safe enough that we can actually say those things.
So self-advocacy really falls directly in line with domestic violence.
Yeah.
And individuals who are in a situation where they are abused on many different types of levels, right? So domestic violence or intimate partner violence isn't limited to just physical signs, right, upon the body. So there's emotional abuse, financial abuse, there are psychological abuse, there's sexual abuse, there's threats. And even in regards to like citizenship and immigration, kind of those things being held over someone's head. So being able to have that voice for ourselves when we are in a situation that we know is not right, but we make excuses for it. And that's sort of what permeates and what keeps going with, well, we just don't talk about it. Like, it just is what it is. Like, oh, but that's what marriage is, that's what it's all about. Like, figure that out. Or that's what it is to have a family. What do you think I went through or whatever? So I feel like with domestic violence, like really trying to support these individuals. And in Shakti's case, it's primarily females, although there are males who do, fall into this category. But from the victims who do call us and ask for support have been primarily females. What sort of gets layered with that is also children and families who sort of witness what's happening. And then there's this like ripple effect.
Absolutely.
Because then the children, right? And it's just like, oh my gosh, make it stop. So I know that it is difficult for someone to ask for help just if they were feeling that depression or they had anxiety or a combination of both, but then to take it to the next level and to say, I don't feel safe.
Absolutely. Absolutely. And I think, those of us that are here and that are going to watch this later, this is an empowerment conversation, right? Whether it's to empower you to say, I need help, or to empower you to go up to someone that is probably struggling because you've heard some of these things and you've kind of picked up an undertone, and being able to say, I need to break the ice and I need to just say something. I can't just keep sweeping this under the rug, right? And being able to be empowered enough to say, I love you and don't take me wrong, but I feel like something's wrong. So spill it, talk to me, I'm here, right? And being able to say that, because that person that needs help may be so overwhelmed, maybe so second guessing themselves and having such insecurities about their relationships with the people that they're around. They may not feel like the people that they are surrounded by can stand to hear their problem, because they're feeling overwhelmed. And what happens if I dump it onto somebody else? Well, they might break, right? And so we're afraid, but chances are the people that are around us have figured out that there's something amiss. And so hopefully this conversation will empower us to kind of reach out for somebody's story, because that's the thing, right? In every story, there's strength. There's strength to be gained from every single person's story, whether it's me telling my story or encouraging you to tell me your story. There's going to be strength that I'm going to get from it, and there's going to be strength that you're going to get from it.
And that strength is sort of that why Shakthi is here, to remind the community that they are not alone and that we are here to help you in the times when you need it most and you feel like you do not know where to go next, or you feel very isolated. Maybe, they are recent immigrants to the United States and they don't have that circle. And, they're too ashamed or something to say, oh, my husband, my partner is doing this. I'm like, oh, but, he's educated, he's wealthy, he's, big in the community. Why would you say that? Or why would you accuse that? Like, there's a lot of, first of all, it's acknowledging, right, that something's really wrong versus going, well, maybe I'm causing this, maybe I'm bringing it on, maybe I'm upsetting him, or maybe I'm doing it, or maybe this is just what, I should be able to figure out on my own. Like, sort of looking at it from that perspective versus also like, this is not okay. And my mental health is, really being challenged because of this violent situation that I'm in. So Shakti is here to really give people a resource. And it's interesting, we get so many calls, and even from out of state, and we are there to connect people with resources, the help that they need. So Shakti is not saying that we're the end all be all, but we're saying we will be the bridge. We will be there to help you get more information that you need, so that whether it's making you culturally comfortable, maybe there's a language barrier, or maybe there's, some religious barrier or something. Like the normal shelter that they have for domestic violence victims is not always informed and understanding on cultural things that do make a big difference, whether it's dietary restrictions or things like that. So Shakti is here to sort of fill that gap and be that resource. And we continue to get, I guess, more and more diverse calls, which means there are people that need our help. And the good news is there's word getting out, but we still need it out more. And thank you for just having this conversation that people don't want to have, because it's uncomfortable. And it's like people literally will say, well, you can talk about it. I'll listen, but I'm not going to, give my 2 cents in there. Like, ooh, isn't that interesting? Or like, oh, let me gossip
Still
about
somebody
this.
else's problem.
Oh, totally, completely.
That's not what I deal with. That's not
No,
what my
I love that. I love that. So yes, thank you. Thank you. You are right in line with what Shakti is aiming to do and continuing to do. So I want to open it up if we have any questions before we run out of time. So I just want to make sure we open that up. If somebody has a question, if you want to put it in the chat, you can do that, and we'll have Dr. Parikh answer it. Or we already have, we need more than one of these sessions. So
I think Karuna has a question. Hello, Dr. Parikh. How are you?
I'm well, thanks.
So far, I mean, it was an amazing information that we received about the stats. The stats, are they from US?
Which
Those are mind-boggling.
the 1 in 5?
Yeah.
Yes.
Oh, wow.
US.
Okay. Yeah, that was something very unusual. I haven't heard about. So that was a good information.
So mind you, right,
that we
the
received.
South Asian population, and I caveated this with the fact that we still need to do more research. So our population is still a very small population, and we're very sort of tight-lipped about what we're willing to share. So the numbers are still, I mean, the data is still based on smaller numbers.
Yeah.
But so you have to kind of extrapolate that out. At the end of the day, you're still talking about a very high percentage, even if you were to say, let's double that and say it's 1 out of 10, it's still 10%.
But still,
yeah,
1 in every 10 person. Okay. Thank you. I have a question, Jamie, and for Beena. So a lot of what you said really rang true. I've definitely heard that question about, oh, once someone is on a medication, will they have to stay on it lifelong? And I used the same thing you mentioned about diabetes in saying, well, usually someone who's diabetic has to stay on a medication lifelong unless they make certain changes to their lifestyle. And I think that analogy really just rang true to me, and it was validating to hear you say that. But also, when you were talking about mental health versus all of the rest of our physical health, I think my feeling on it is that I think that the reason that people look down upon talking about mental health is because they feel that mental health is shameful, it is because of something you did wrong, and that's why it becomes something embarrassing because of a weakness that we have within ourselves. Whereas anything else that's physical health, like diabetes, even though that also could be because of something we did, lack of exercise, not eating well, but there's also other genetic factors. We're willing to accept all that in that category.
Right.
Whether a part of it did have to do with our own, it being our fault or through genetics or whatever, somehow we're willing to make that connection there, but unwilling to make those connections with our mental health. And it's not
Absolutely.
seen as a sign of weakness when it's physical health.
Right. And so to your point, right, genetic predisposition to diabetes or heart disease, we accept that as being genetically passed on from ancestor to ancestor, right? Or from hereditarily. However, one of the major things that we talk about in Indian culture and in Hinduism is karma, right? Karma, dharma. It's all about what either your ancestors did to create your good fortune or what your previous life did to create your good fortune or misfortune. And yet we don't think of those things as being okay to be saying or talking about as being passed on generationally or genetically, quote unquote, right? And somehow we need to look at it as a weakness. We need to look at it, as you said, as something that we chose to do on our own. And if we were just stronger about it, we could figure out how to pull up our bootstraps and make the effort. I did want to actually talk about real quickly with your question about the medication. And Jamie, you did ask me this, and I actually forgot to talk about it. The question about, would you need to stay on the medications for the rest of your life? And in many situations, actually, my answer to that would be no-ish. So if you're dealing with some of the more severe psychotic disorder situations, depression, schizophrenia, bipolar depression, yes, you're talking about a lifelong partnership with that medication to help make sure that your life is protected from the disease, right? When it comes to depression and anxiety, there's definitely time and room for, as some of that noise gets turned down, as some of your skill sets get improved, as you're working in counseling, learning strategies, learning how to manage some of those things, that in time you can come off of it. And I kind of liken it to wearing a cast when you've broken a foot, right? You wear a cast, and after some time, after that bone has been healed, you can come out of that cast. But what happens? That leg that you've broken is going to be forever weakened at that spot. And so you have to take extra precautionary measures to make sure that you don't go out there and just break it again, right? So you have to do things to protect that partnership, again, that you've done to create good health. You've got to protect it. And for some people, that can mean that you can come off the medication and simply continue to use your strategies, whether it's counseling, therapy, or whatever it is. So it's not a given that once you start medication, you're on it for the rest of your life. For some, it is an absolute necessary partner in your good health. And for others, you can come off of it and have other things be a partner for that. Hope that answered that.
Thank you.
Thanks, Letha. I appreciate that analogy of the diabetes. My father was a type 1 diabetic, and I remember we would time our eating based on his, long-acting, short-acting insulin. And it was like, oh, he has to go give himself a shot. And I just I'm laughing, thinking, I'm like, I need to take antidepressants. Can you guys wait a second? I mean, it doesn't happen like that, right? Oh, so crazy. Okay. Alex, you had a question, and I think you put it into the chat. Alex asked, can you remind me what was 1 out of 5? So that statistic, that was 1 out of 5, Dr. Parikh?
I think it was 1 out of 5. Oh, 1 out of 5 South Asians will report or have had an experience with a mood or anxiety disorder in the United States.
Yes. And that's just a staggering statistic. That means, to your point, you use the analogy, let's count off how many attendees we have live right now. you know, there's a portion of us that fall into that category, whether we're ready to see that or not.
And
So,
mind you, when we talk about mood disorders, depression, anxiety, that doesn't mean that you're, you know, unable to get up out of your bed and, you know, you're just crying all the time and just completely an invalid.
no, yeah.
Doesn't mean that, right? So, and those are the things that I wish we could kind of erase the image when we say depression and anxiety and mood disorders. The minute we say that, we think of the worst case scenario, someone that's just crying and devastated and maybe even suicidal. Someone could be just not sleeping well and not adjusting well and thinking and worried all the time and still be experiencing a mood and anxiety disorder and still be experiencing disruption in their daily life. And that means they're still experiencing a mood and anxiety disorder.
I appreciate you really kind of releasing that stigma and helping us just connect the dots that it's very realistic and it can ebb and flow for us, depending on whatever's going on in our life. Like I had really bad postpartum depression after the birth of my son. And so there was a moment where I needed some extra support outside of just, you know, suck it up, buttercup, and enjoy being a mom kind of thing. So I really appreciate your honesty about that. So I do have a request for everybody who's still on the call. We would love to have a group photo. So if you're comfortable just giving us your beautiful smile for a second so we could do a quick screenshot, we would really appreciate that. So Shakthi, we are growing and we are continuing to get the word out. And it's the opportunities like this when people hear about this and they'll participate in this empowerment session 8 months from now or a year from now, that we do appreciate that. So if you're comfortable, if you don't mind, we would love that. And in the meantime, while you're getting yourself maybe on camera, I do want to mention about our annual gala. It's our 7th annual gala coming up on August 23rd for Shakthi. And we just get bigger and better every year. I got to say it. It's pretty awesome. So this is an opportunity where our community comes together and we have an amazing night where we honor some very important people who have really helped us get our cause out there and help more people. And we have a silent auction and we have great food and dancing, and it's just a time to connect. So this year we're doing something fun. It is the theme of masquerade. So, and it's pink and gold theme, just planting a little seed in case anybody's interested, but please go to our website. You can register, and also our sponsorship packages are available and open now. So, and we have that information as well. So, and silent auction, if you know anybody or you have people that you do business with often that might want to donate something for the silent auction, please point them in our direction. We would love any contributions that we can get. And it's such a way to honor our community and really tell people about the amazing businesses we have locally too. So. All right, we're going to take a quick picture if everybody's okay with that. So I think Anu, I will take, if it's okay. Yeah.
Anu, if you
Of course.
Yes.
I froze. I'm so.
We thought you were just smiling.
you You're like, she's like a man. I can't get the video back. So maybe Anu, you could take a picture for us.
I got the picture.
You did. Okay, great. Thank you. I'm just seeing a frozen screen. So Dr. Parikh, thank you. Thank you. Thank you. On behalf of Shakthi, on behalf of our South Asian community, and on behalf of individuals who are not sure if they want to get some support, but they're maybe thinking about it, we hope this conversation can just plant that seed that they may need for themselves, a friend or family member, to really sort of do what's next best for all. So thank you for your contribution and thank you for your expertise. And it's been an honor.
You're welcome. Thank you for allowing me to be here and doing this. This is such a vital and important conversation that we need to have. So looking forward to many more.
Thank you.
Jamie,
Thank you
if
so
you
much,
can
Dr.
leave the Dr. Parikh's information in the chat if anybody needs it.
Thanks, everyone. Have a great night.
Thanks
Thank
all.
you. Good night.
Bye, guys.
Bye.
Thank you.
Thank you.